in an increasing number of the global confirmed numbers of COVID-19, which also imposing a greater pressure on our country's prevention and control. So we should continue to strengthen the border area in order to prevent imported cases and also make sure that there is no domestic transmitted cases caused by imported cases. And we should protect people's life and healthy and also promote vaccination. As of November 19th, we have more than 2.4 billion people vaccinated. That's the 2.4 billion doses being administered and more than 1 billion people vaccinated. So today we will continue to brief you regarding the COVID-19 containment as winter comes. Today we invite Mr. Wang Dengfeng from the Administration of Sport, Mr. Wu Liangyu from CDC, Madam Guo Yanhong from Ministry National Health Commission, and also Mr. Zhu Hongming. And Mr. Liu Hongbin from the State Administration for Market Regulation. Now the floor is open. Please identify your media affiliation before asking questions. Xinhua News Agency. According to the daily report released by the National Health Commission, besides Dalian and some of the places with new cases reported, but for the majority of the ACGs, there's no new cases reported. Now, my question is, what is the bigger picture of the COVID-19 situation in China? I'll give the floor to Mr. Wu Liangyu. Thank you for your question. As Mr. Mi Feng introduced, for this round of COVID-19 resurgence, we have seen a good momentum in containing the COVID-19. Besides Dalian of Liaoning province, the rest provinces just saw a low number of sporadic cases, but the majority of these cases actually came from the centered quarantine area or the controlled areas. So which means right now the situation under control and also the situation in Dalian also showed a declining curve of COVID-19 cases, which means we're facing a less risk. But still, that said, we still face the potential of new cases reported. By implementing the State Council's guidelines, the ministries and localities initiated the emergency plan in order to implement the own measures of COVID-19 prevention and control, so which means within the one silent period of COVID-19 virus, we have curbed the spread of the virus. But that doesn't mean that we can lose our vigilance on COVID-19 prevention and control. The National Health Commission will keep a very close eye on the situation of COVID-19 in all places. Thank you. CMG CCTV. As we talk about for this round of resurgence, we have seen a fast containment measures taken in the border areas and port cities. So what's the new lessons we learned from this round of the resurgence and how that help us to prevent the COVID-19 spreading inside China going forward? I'll first invite Mr. Wu to answer your question. Thank you for your question. This time, we have seen a faster spread of virus impacting more places. But the good news is that we curb the spread of the virus in a faster manner. by referring to the good practice in Shanghai and other places, we have taken powerful measures. First, we strengthened the reporting mechanism. The State Council Joint Prevention and Control Mechanisms also sent teams to provide on-site guidelines, make sure that we could buy more time to contain the virus. And we also established a team for the epidemiological investigation, and also we have the different working teams to create the synergy. And we also sent a expert team from the National Health Commission to the affected area, and also outlined the places for restriction, for control, and for the tracing close contacts. Third, we also speed up the work regarding the origin tracing. For the potential affected or infected people, and we screen them out as early as possible, and also we practice the prevention measures to prevent the imported cases from local spreading, and covering the air routes, sea routes, and also the land routes. We also actively released information in a timely manner, make sure that the public learn a picture of the prevention and control situation, and also to report themselves if they are close contacts or they visited to the places where the confirmed cases found. Why this round of the resurgence could be contained in a faster manner, that also should give the credit to vaccination. As of November 19, more than 1 billion people fully vaccinated. Covering 76.3% of total population. And also more than 65 million people had their third shot, which also play a big role in curbing the spread of the virus. So going forward, we'll sum up all these lessons we learned, and we'll focus more on the practice of the prevention control measures, and also to further promote the vaccination so we can do a good job, especially a new year is coming. Regarding the medical treatment and the nucleic acid tests, this round, we can see that we have a really good practice and the experience. One of the experience we learned this time, first, we sent the high-level experts from National Health Commission to the affected places, and we also transferred the confirmed cases, confirmed patients, to the designated hospital. And this time, there is a place which in a remote area, and it just had 2 hospitals. And overall, we can see not have a quite sufficient bedding capability and also the helping hands. So we sent a national team to that places, and we found like a local medical capability actually that meet our needs to treat the patients. So we use a chartered train to transfer the patients to a bigger city hospital. So far, we transferred 164 patients in 6 batches to the designated hospital. So this is the place in Inner Mongolia. So far, among the 164 patients, 161 patients all discharged from the hospital. So we can see this is very good news. So our hard work paid back. So for this small city, a population less than 30,000. We also sent another experts group from Shanxi, consisting 90 medical staff, to Exinaji in Inner Mongolia. Make sure that the local residents can go to the hospital to receive treatment to deal with the daily or the normal diseases. Right now, they have finished their work and back to Shanxi. So we have already had a good practice from the very beginning of the COVID-19. And in Dalian, at the outset of this round of resurgence, it's more than 300 people affected. And immediately empty a hospital with more than 200 bedding capability, and we sent the experts from the national level and also provincial level and local level to give the customized treatment plan to each infected patient. Yesterday, 12 patients discharged from the hospital. Regarding NAT testing, so we could learn the scope of the infection and also buy more time to curb the spread of the virus. In Exinaji, one of the key roles played by NAT is that in a very short time period, we dispatch NAT force to conduct city-wide NAT work, especially in the key areas and also to the key people. So before, for this small city, that's the daily testing capability just around 1,000 tubes. And we also dispatch the additional help to this place. So there's less than 1 day, they could finish all the testing covering the whole city. So that daily capability reached more than 20,000. So same for Dalian. Before, that's the 248,000 tubes. But for Dalian, the population is around 6 million. And also, we need to give additional testing to the key areas and the key people. So we improve that the capability to 300 to that the 600,000. So make sure that within 2 days we could finish the Dalian citywide testing. So our key experience from testing is that we should further leverage the role played by the national and the local NAT forces. So we help the COVID-infected places to boost their capability of testing, so that also can provide a great support to curb the spread of the virus. Thank you. 额济纳旗 and Dalian is the two places with the new cases found, and also we learned that the actually community also can play its role. So first, we should do everything in a very fast manner. So we should talk about that the restricted places, the controlled places, the community should play a role, and also to further curb the spread of the virus among the community. And we also talk about that the grid manner, working style, and also we should have the people in the community to check the information of each household. And also for each community, we not only check the community residents' health condition, not only ask whether they had a fever or not, we also ask for other key health factors so that it can provide more accurate information to us. Thank you.
好，请继续提问。好，我们来请左侧区第2排第2位女记者。
谢谢香港中评社记者提问。在本轮大连疫情中，张和
CRTT
报告了多例在校学生。
This time we found that the schools, the universities, reported the cluster cases found. So what the schools can play its role in the disease prevention and control, and for students, if cannot not go anywhere else, then how we can provide service to the students locked in schools. Thank you for your question. This time we also found that the cases in universities or in schools. So we should do the 3 jobs first. If there is a school reporting cases of COVID-19, they should first give treatment to the confirmed cases. And second, and we should also practice the stringent measures, including quarantine measures based on their different risk levels. And the National Health Commission also released the guidelines regarding the COVID-19 prevention and control practice for the different risk level personnel. They should follow different quarantine requirements. And the third, once a school found confirmed cases, no students allowed to go outside. So no matter if the faculty staff or the working staff or students, they should be all quarantined within the school campus. And fourth, should do a total cleaning work. And that should be follow the practice regarding infectious disease prevention and control protocol. So make sure that the school with COVID-19 or the surrounding places can rest assured. So we need to do a good disinfection work. And we talk about that if the school is locked down, then we should first have good supply, make sure that the logistics system is unimpeded. For the schools, if the COVID-19 case is found, then they should all move their offline cases to online teaching. And also we talk about this kind of the lockdown practice. The faculty staff, also the students, may need the psychological service because this is quite impact their normal way of life and the way of learning. And we also make sure that information is smooth and transparent, especially that information should be available to the parents of students. Based on our current practice, and the school actually work very well with a local CDC or the Health Commission, so the information is accessible to all the related parties. So what else we should practice? We should do the following 5 parts. We talk about the COVID-19, it's far from done. So we should never lower our guard against the COVID-19. And also we need to check the practice of disease prevention and control is delivered into the letter. And also for all the schools actually have the air plan in place, and also for the disinfectant, whether can be carried out in a timely manner. And we talk about supplies, including the anti-pandemic supplies and also the daily necessities, whether are in good stock. And for the practice of the containment measures can be implemented in a faster manner. And we also will look at vaccination, whether we have a good education to the target audience regarding the vaccination. For schools, once we found a confirmed case, actually the school conditions not meet the requirements of quarantine, we talk about especially for universities. If we found the confirmed cases in universities, and we also need the help from the localities. So all in all, what we have done is to make sure that no matter the case found in school or not, we make sure that the school is well protected and students are well taken care of. So my question to the State Administration for Market Regulation. Since the outbreak of the COVID-19, the State Administration for Market Regulation has earnestly implemented the guidelines given by State Council, the CVC Central Committee, and a Joint Prevention and Control Mechanism, and especially emphasizing on the imported goods. By exploring different cases, right now we have set up a working process and a system. So first, we also strengthen our day-to-day supervision work, especially keeping a closing eye on the food processing companies. And for the imported material, we also have a designated places for receiving all these imported products. For the selling part as well, they have a specific a shelf to sell all these imported material. And also we talk about all the imported goods should have the NAT test certification and also other certifications. So we can check the end-to-end process of the imported products, so we can know exactly where it come from and the processing places. Second, July 2020, we found the COVID-19 positive virus from the packaging of the imported products. The local market regulation bureau carried out a large scale of the checking work. We checked the imported products, especially the products from the COVID-19 confirmed cases found countries. Third, we also had the system available to trace the origin of imported products. So we developed a tracing platform online so that helps us to check the origin of processing and the selling information of the imported cold chain products. Right now, this platform is available online. So the data also can be shared and linked with other platforms. So the cold chain products, especially the imported products, can be checked via different platforms. And we also carried out a training, make sure that we improve our capability to check the cold chain products, especially the frontline law enforcement staff. They are capable to carry out the work to check the imported products, especially to screen out the potentially infected products. And we also have given out the trainings in this regard, and also we have carried out the different practice to simulate the situations where we found the COVID-19 positive imported stuffs. Judging from the results so far, all the plans and the measures have worked out against the virus. And going forward, we'll strengthen our measures and also to urge the local market regulation bureaus to practice into details of all the measures and practice, and also keep a close eye on the imported cold chain products. Make sure that we build a strong wall to separate the virus inside China and the packaging of the cold chain products. From the economic channel of the CCTV, and we talk about that. Right now we found that for quite a long time there is no death case reported. So that also means that the medical treatment really had a good practice. So any good experience you can share with us? Thank you for your question. We talk about since the very beginning of the COVID-19 pandemic, we always put people's life and safety above everything else, and we have actively explored the effective measures to treat the patients. From the October 17th to now, to this morning, so far 667 patients, accounting for 40% of the total confirmed cases, now free from hospital. That's the number for this round of the revisit of COVID-19. And I can give you the 4 good practice regarding treatment. So we talk about that the 4 centralization and the 4 early practice. So we talk about for the whole hospitals, especially the fever clinics, that we always emphasize the keyword early. So we talk about that we should find the patient in an early manner and also to transfer all the patients into the designated hospital so they can receive a collective and centralized treatment. Right now we have a group of the highly skilled medical experts. They have rich experience in dealing with COVID-19 virus. So once the case happened, we dispatched this group of experts to the affected places so they could work with the local experts to treat the patient. We talk about that plasma, that we will dispatch all these plasma to treat the patients. And the second, we also take actions in the COVID-19 prevention work. So, which means that we take a more active action to treat the patient, that we give the oxygen earlier to the patients, and also have the TCM also involved at an early date to treat the patients, especially for the patients at the people, elderly people or people with underlying diseases. And we actually give them more treatment at an early date, so to prevent these group of people that develop to the severe cases. And if they are in the intensive care, and we also have good practice to save their lives. We talk about right now the patients in the severe situation. We talk about the people with ECMO or the respirator. Or the intubation. Actually, the number of these kind of patients is much lower, and also they can very soon get rid of these kind of the treatment measures. And also we talk about patients with multiple underlying diseases. We not only treat the COVID-19 infectious disease, we also treat the underlying disease at the same time. So we can strike a balance in our treatment plan. If necessary, we also send the experts to provide online or on-site help So this is a cross-discipline team, so they can provide a customized treatment plan to each and every patient. Third, we talk about our treatment actually is a combination of Western and traditional Chinese medicine. We always emphasize that the Western and the traditional Chinese medicine are equally important. So for the TCM, they also involved at a very early date, so we provide a best solution to the patients. So these are the four very important experience we have learned from our previous experience. At the same time, we also actively support a scientific research team in developing the medicine. So for the immune globulin and also the small molecular medicines, these research actually have received our support. From paper, we talk about that many places actually carried out a large citywide NAT. My question is that with this citywide NAT, how we can find and make sure that no one left behind, and also that we can find the origin of the virus. Thank you for your question. And this is actually NAT is a very technical issue, and that also involved a large number of people. We bring them to the NAT place. And we also need to make sure that we should finish the NAT in a fast manner, especially to give the NAT to the controlled or restricted areas. We always emphasize that testing plays a very key role in curbing the spread of the virus. As other colleagues talked about, actually NAT is one of the most effective measures to curb or contain the virus. We talk about that anyone should be tested. So we also issued that guideline. That's right now coming to the second edition of this guideline. That's the guideline for the NAT, especially the large scope of people NAT management. That involve 4 areas of content. We talk about that the citywide or large number of people NAT is a systematic work or systemic projects, so that requires a local government should have a strong capability to manage NAT and also make sure that people involved know their role and responsibility. And we also talk about that the different departments, and including health sector, the public security, transport, OP chain to create that synergy. So the NAT plan should be as detailed as possible, so that should actually lock to each and every small units, which means for each household, each office building.
第二个方面呢，很重要的就是要摸清你的目标人群的底数。那么判断是否不漏一人。
And we talk about how we can make sure that no one left behind in terms of testing. That we should actually, when we're making a plan, you should have a good knowledge regarding the population within the controlled or restricted area. So that's actually based on the population consensus and also the permanent residents. So we can have a base number of testing.
很重要的就是要合理划分你的这个布点的这样一个区域。
And third, you need to arrange a rational booths for NAT. So that should be based on the density of a population, a transportation. So we can locate the testing booths in a rational manner. So our principle is that we take the community as the center of our layout. So our NAT layout first should be centered by communities, and that also can provide the service to schools, to the enterprises, and also for NAT, and also make sure that the people not be gathered in a very long queue for receiving NAT. So that can prevent the cross-infections.
在进行了全员核酸检测的这个过程当中，信息化的技术支撑是非常非常重要的。因此呢，我们鼓励各地通过多种形式，
We encourage
对我们辖区内居民的这些
localities
进行收集
to collect the information of each compound, and also
核酸检测从采样
we talk about 40 samples from a collection to transport, to getting the reports, and to uploading the reports. All these should be available online. So let NAT play its full role in curbing the spread of the virus. Right, Star News. My question regarding that the epidemiological investigation in the one of the university in Dalian, because in this university we found a cluster of infected cases, and also the infected personnel. Actually, that's the staff working for the cafeteria. Thank you for your question. Yes, indeed. If we look into the schools, for the logistic part of the working staff, actually they not have the contact with the people outside the campus, and they actually also have a quite close touch with the material or the goods. So if the people, the working staff infected, then that's a big risk. We talk about this group of people, actually that's with the high mobility, which means that they actually need to go in and out the schools. So for these group of people first, for the working staff that have a frequent touch with the faculties and students, they should be vaccinated. So they should be fully vaccinated. And also at the same time, they should wear masks and they should use the N95, and they also need to change their gloves and also the uniform and regular manners. And also the situation happened in Fujian. We found that Fujian, the local education sector, released a requirement asking the regular NAT covering the students and staffs in schools. So right now in China, 23 provinces actually carry out a regular NAT in schools. And we also at the same time should monitor the health conditions of the working staff. If any symptom found, they should report immediately. Fourth, we talk about the environment in schools. We should also do the cleaning work in every corner of the school. And also fifth, we should take good care of the working staff. Thank you.
好，谢谢，请继续提问。好，我们来请右侧区第一排第二位女记者，红色衣服的记者。
谢谢主持人。中国新闻网记者提问。我们注意到这次的大连疫情中，
China News Agency.
乡镇和街道出现了社区传播。
And this time in Dalian, we also found that the transmission in the communities. What kind of measures we could take to curb the spread of the virus inside the community?
想问一下，这样的措施有什么好处？谢谢。
And also the quarantine this time is also the outside quarantine in communities in Dalian. So why we take this measure? Right now, first we can tell you that the virus right now is already cut off in terms of its transmission among the community. So we always talk about the community actually play a key role in containing the virus. So which means all the measures regarding the joint prevention and control should be better implemented. This time we found that for each residential buildings, actually they have there that the building chief, and also we have volunteers, the community leaders all work together to organize people to receive NAT and to check the residents' health condition check. And also second, we talk about for each and every fever clinics should be the whistleblowers. And also regarding data and information, they should be shared openly. So that can help us to know exactly that trace out the close contacts. That will also help us do the epidemiological investigation. For a different risk level, we have a different practice to carry out for a different community, and also we talk about the restricted areas, controlled area, and all these to make sure that we have a special team to provide a purchasing of daily necessities, make sure that the residents in the lockdown areas also can enjoy a daily necessity delivered. In certain places, especially at the outset of the outbreak, if we could carry out effective measures, we could curb the spread of the virus in a faster manner. So which means that we should control the traffic or the mobility of residents. So we talk about the decentralized quarantine. So if a condition allowed, we ask people to quarantine one person per room.
好，谢谢，请继续提问。好，我们来请右侧区第3排第2位男记者。
谢谢南方都市报记者。刚刚多位领导讲到了国家成立了流调会。
Metropolitan newspaper. My question regarding that the national level regular epidemiological team. So what's the consideration behind? Thank you for your question. And also thank you for your interest and your support in the epidemiological investigation. I do not need to further emphasize how important it is regarding the epidemiological investigation work. For CDC, right now we have selected around 300 personnel. To consist this national level epidemiological investigation team. Once the confirmed cases are found, so we can dispatch the group of experts nearby so they could rush to the scene and then carry out their work. Within 24 hours, we could figure out the spreading chain of the virus. And also for every month, we also have a working shift arrangement. Make sure we always have the team waiting on call. In order to improve the accuracy of the epidemiological investigation, we also have the working mechanism in place to manage the team
国家流调专家队平时加强专业能力的建设，保持应急准备。
So the team always stand by
理论培训
and they receive trainings and also have a learning by doing
特别是
mode
加强与
of training.
对口支援片区的这种流调队伍的交流衔接。
And the national team also pair up with a local NAT team so they can exchange their
始
experience.
终保持国家流调队这个专家组的这个能力和水平。下一步呢，国家卫生健康委将密切关注各地的。
So make sure that the national team can own a very good competent to carry out the NAT. And this team always stand by on call. Once the case happened, we will always have a team rush to the scene to support the work in the affected places, to trace out the origins,
提高疫情处置的科学精准水平。
so that we can make our decision regarding the COVID-19 prevention control in a scientific manner,
传播，谢谢。
so we can also contain the virus in an early date.
好，我们来请左侧区第3排的第3位女记者，谢谢。
谢谢主持人。封面新闻记者提
Cover
问。
news.
根据防控要求，居家健康监测期间，不少群众虽然没有上班，
Talk about the
但是对于
people
他们的外出
required
活
to
动
stay at
都
home.
有硬性的限制，并且居家监测个人报告体温监督难度比较大。请问，
There's no really a harsh requirement on this group of people, so they may not go to work, but actually there's no restrictions on
我们请
their
朱荣女记者
mobility.
来回答这个。
So how we can monitor this group of people?
那么这个问题呢，其实
Thank you for your
还是在
question.
强调落实一个4方责任的问题啊，就是我们这个居民在家里居家
So we talk about that a stay-at-home health condition monitoring.
个人还是要承担自己的
So first, each and every person should be responsible,
报告有关的身体
and they should report their health condition to the local authority, and of course they not
另外一个呢，我们的
encourage to go outside, especially go to the public gathering places.
一个监督和管理啊，我们的社区啊，
For communities, they play their role to have a specific window person
接好这些
to
有关的这些居家
monitor
健康监测
the personnel staying at home.
像我们的部门
And third,
也有自己的责任啊。
for
不能说我们的这个单位的
companies,
职工或者是员工
if your staff,
在小
your
区里面居家
employees
健康监
right
测
now is under stay at home,
我想，这也是不应该的。我们的单位也应该落实自己的职责。
for
对本单位
companies also should shoulder their
也
responsibilities.
要加强管理，督促他落实居家健康监测的有关的规定。那么对于这些居家健康监测人员呢，我想，有些地方啊已经在探索一些有效的管理措施，比如说必要时可以通
If
过
necessary,
文词啊，或者通过智能体温贴等技术手段，加强健康监测，有效的加以管控啊。我想这些地方啊已经在做了。
I
那么
believe that right now the localities also have the effective ways to check the mobility of the stay-at-home personnel.
负责随访或者是有关的这个管理，这也是落实4方责任的重要的体现。那么我们工作人员的防护啊也很重要啊。
And for the community working staff, they should also be well protected.
国务院应对新冠
This year, August,
联防联控机制综合
the
专门印发
Joint
了
Prevention and Control Mechanism of State
重点
Council
单位、重点人群的
released
新冠肺炎疫情的常态化防控的相关的防护指南啊，明确
a
了社区
guideline
工作人员
regarding
的
a regular
重点人群的
the
防护
practice against COVID-19, especially emphasizing on how we can better protect
工作人员的防护
the
的
community
我想啊
staff
这些工作都非常
on the
重要
front line.
那么我们在社区的防控工作中啊，要求我们的社区工作人员要进一步加强有关的培训啊，配备好有关
So
的
our
这个设备
community staff should
督促我们的
receive the
指导
good
的社区工作
training,
人员提
and
高
also
防
they
护
should
意识
protect
规范
themselves
自
when
身的
carrying
防
out
护
their work.
既要做到防护到位，同时呢也不要过度的防护。谢谢。
好，谢谢。时间关系，我们最后再提
Due
两
to
个
the interest of time, two last question, please.
好，我们先来请左侧区第3排第2位女记者。
谢谢主持人，我是中国教育电视台记者。因为最近的校园疫情，
Education
我们看到
TV.
很多学校也是加强了这个防控措施。
Right now, we have seen a growing number of schools which strengthened their COVID-19 prevention and control measures. My question is how we can better manage students and faculties going in and out of the school campus. We talk about when the case happened in schools, the schools locked down temporarily. And for the normal practice of COVID-19, the school should have the close eye monitoring the staff coming in and outside the school campus. We talk about no matter students or faculties. Once the COVID-19 case is confirmed in the school, so the faculty staff and students should be in lockdown. We talk about the most of the faculty staff actually not live inside the campus, so they should be quarantined at home and also give their lecture online. Regarding logistics, so first and foremost, we should meet the people locked down inside the campus, their needs for daily necessities. So for the people working for like a cafeteria or for the logistics, they should go in and out the school campus more frequently. But for the students and faculty staff, they should follow strict the quarantine standards. So for different group of people, we have a different standards in terms of quarantine. And for normal or the regular practice of COVID-19 prevention and control, they should base on the requirement of the localities. So for schools, you cannot carry out one size for all measures. A different group of people, and they actually have a different situation. So we need to actually categorize a different group of people and matching them with a different level of the COVID-19 prevention and control practice. So we should have a very good gatekeeper. We talk about the COVID-19 still give a big toll to students because they quite impact their normal way of learning. So we should also provide the available psychological counseling services to students and faculty staff. People's Daily. The farmers market actually is also have the high possibility of the COVID-19 virus spreading, and also is places gathering a lot of the people, and what kind of the COVID-19 prevention and control measures we practice in the farmers market. Thank you for your question. Indeed, farmers markets actually are the key places to meet people's daily necessities needs, and also with a high mobility. And also sometimes this kind of market actually is also a very large places indoor. August 2020. A technical guideline regarding the COVID-19 disease prevention and control practice in farmers market were released. And we also have a follow-up guidelines regarding the normal practice regarding COVID-19 prevention and control in farmers markets. So for all these guidelines, actually, that covered all the people inside the farmers market. So that includes a practice of disinfectants in the public area and also in each and every merchant booth, and also how we can better protect the customers visiting the markets and the requirements to the customers. And for our administration, also carried out law enforcement supervision in the markets.
为了完成上述的职责任务，切实保障疫情防控常态化形势下的市场销售食品和食用农产品质量安全，市场监管总局重点就监督指导农批市场落实
So for our administration,
和疫情防控政策措施，明确提出了3个方面的工作要求。
has raised 3 requirements. First, we ask the market owners to abide by the laws and regulations. Any agricultural products inside the market and also the personnel inside the market should be well checked. And for the agricultural products without certification should not be sold in the market. And also the products sold inside the marketplace that should be also checked. For merchants, they should also pay the responsibilities to know exactly where their products come from. And for the market owner and also the merchants selling imported cold chain products, they should provide the required certificates. So that the certificates required 3 certificates. If they cannot provide these 3 certificates, or they act wrong behaviors were found, they should be held accountable. So far, we have found 332,000 merchants with wrong behaviors. Going forward, our administration will beef up our law enforcement work in farmers' market and to urge the market owners and merchants to implement the COVID-19 practice, and will also cooperate with the Health Commission to make sure that we curb the spread of the virus and there is no risk of the agricultural products. Thank you. In today's press conference, the speakers introduced about the COVID-19 containment measures in the communities, in schools, and also the medical treatment situation. Thank you all the speakers. This is the end of the press conference.